At this time, I want to bring back Dr. McLaughlin Davis and Stephanie Daniels, who are going to present the hospital case management white paper.
Good morning, everyone. Great to see everybody. You know, when shortly after I came on the national board, and even before that, there was always the question, how do you staff a hospital case management department? So for those of you who are involved in hospital case management, it always seemed to be give us a number or tell us what the ratio is, give us the magic sauce. And when I came on the board as pre-president, Kathy asked me, what would you like to work on? And I said, this seems, I'm a hospital case manager. This seems to be just such a burning question. So that's what I thought I wanted to work on. I want to introduce Stephanie Daniels, my colleague, who is a consultant to hospitals across the country. And we collaborated, brought forth an esteemed interprofessional group of individuals, all CMSA members. And again, you can, read their credentials and read their names. They're across the country. And we worked on what would hospital case management look like. You can advance the slide, please. So what we came up with as we talked was it really isn't about staffing. It really isn't about ratios. It really is about the work we do, which is care coordination. And we know that hospitals and healthcare organizations, health systems, payers, as Stephanie said, you go ahead and say it, Stephanie, everything's topsy-turvy.
Well, we were just saying how everything was topsy-turvy, and in talking to the members of the task force, we realized it was way beyond, the task was way beyond giving answers to the inquiries that the people at CMSA Central had gotten. And that we thought it was time, given the topsy-turvy nature of hospitals today. Hospitals are in the insurance business, the insurance people are in the hospital business and the care business, and everybody wants value. So what does that have to do now with hospital case management practice? And so the task force unanimously agreed that maybe this is the time that we tackle the issue of hospital case management practice, and that was our focus. That became our focus. It's been 30 years, I gotta say. I've been in the business before I was a consultant. I was a COO and a CNO and a director of case management. So it's been 30 years that I've been hoping that our national representation, a national organization would take a position on hospital case management. So I'm delighted that under your leadership, we finally are. So, to that end, for those of you who are interested in hospital case management, we have a copy for you, compliments of my wonderful organization, the Cleveland Clinic. Yay. Printed a copy for anyone that's interested. It'll be available at the back of the room. There'll also be a link on the CMSA website.
Yes.
So you can access it wherever you might be.
Yep.
Yeah.
There, yep, thank you.
Exactly.
And Stephanie and I will go a little more in detail, which I believe is on the next slide. So if you want to learn more about it, or if you're going to another session at that time, of course, it'll be on our website for a little further down the road, or you feel free to reach out to either one of us, and please take a copy. And again, I really want to thank Jose and Kathy for allowing us, for supporting us and allowing us to go forward with the work. I really want to also thank the committee members because, as you know, a project like this takes a lot of time and they're all volunteers. So thank you so much.
Thank you.